5 minutes of questions.
Excuse me. Thank you, Mr. Chairman. And I thank the witnesses for testifying before the Select Subcommittee today. The coronavirus pandemic changed many aspects of day-to-day life, especially when it comes to healthcare decisions. And I say this as a physician, 24-year military veteran who did healthcare both as a nurse and as a physician, and then a former director of the Iowa Department of Public Health. Most noticeably changed to me was the doctor-patient relationship. As a physician with decades of experience in delivering care to patients of all ages and in various healthcare settings, I not only recognize, but I value the fact that the medical needs of patients can rarely, if ever, be broad-brushed. Individual needs vary drastically. This can be due to allergies, comorbidities, intolerances, and other aspects of culture or things we don't even understand. And that requires a robust doctor-patient relationship. It's why I was so appalled by the multitude of COVID-19 vaccine mandates imposed by federal, state, and local governments throughout the pandemic. COVID-19 vaccine mandates completely removed the doctor from the doctor's office, from interactions with their patient, and instead empowered unelected bureaucrats to make medical decisions for millions of Americans with no regard for individual health needs. Now, to be clear, I was vaccinated. I gave vaccines in all 24 of my counties and held vaccine clinics and workplace clinics, participated in them throughout the pandemic. But I would never condone, and I did not at that time condone, encouraging, forcing someone to receive a treatment, vaccine, surgery, or any other medical service without first giving them the opportunity to discuss with their physician and, if they desire, to decline the service. COVID-19 vaccine mandates had damaging effects not just on the doctor-patient relationship, but on our economy, our military readiness, our trust in public health, judgmental behaviors, anxiety, distress amongst family members, and others. I'm grateful that the Republicans have taken the initiative to evaluate the effectiveness or ineffectiveness of these mandates. Dr. Bardosh, your paper in the British medical journal Global Health discusses the unintended consequences of the COVID-19 vaccine mandates. The Biden administration imposed several, including the DoD mandate for military service members, executive order mandate for federal employees and contractors, the OSHA mandate for employers with 100 or more employees, the CMS mandate for healthcare workers at facilities that participate in Medicare and Medicaid, and the HHS Head Start program COVID-19 vaccine mandate, for which we know young children are at the least risk. Can you highlight the ramifications of these mandates, such as no jab, no job policies, vaccine passports, and social lockdowns for the unvaccinated?
That's a big question. Let me just say this. There's no doubt in my mind that these mandate policies are going to be responsible for the increase in distrust the next time there's a pandemic and the mobilization of resistance to a future vaccine in the future pandemic. And I think it's really shocking and kind of a little bit sad that my colleagues in the public health community who are pro-mandate don't understand this. I considered prior to the pandemic myself a Democrat. I was a Bernie Sanders supporter. And to sort of be ostracized from a progressive camp has been very illuminating, we can say. And I just think in general in this country, we really need to try to understand each other across the aisle a little bit more. And when we talk about political polarization, what is that? It's that the two sides grow further and further apart from each other, and they speak different languages. And I just think it's obvious. People who have a lack of trust now because of these mandates are going to distrust the government more the next time around. And it's very likely that the next pandemic has a higher fatality rate. And then what are we going to do? We're going to start quarantining people, locking them up like they did in Australia or Austria, having these sort of differentiated lockdowns. If you're not vaccinated, you need to stay in this sort of quarantine camps. For how long? If COVID had a higher fatality rate, we might have started going down that road here in this country. I mean, we need to be prepared for that and think, well, what happens to civil liberties if there's a 10% death rate, a 5% death rate? There's some serious thinking that needs to go on in this country. So thank you.
Thank you for that. I didn't expect a comment on your political affiliations, but I am concerned about the loss in trust in the public health system. Our local public health people were phenomenal throughout the pandemic. That trust is going to be hard to regain and has led to an increase in anti-vaccination movement, especially for childhood immunization. So thank you so much. I yield back. And the other question I have, I will send to the committee to be responded.